Good morning. It is Tuesday, September 28th. Welcome into the Morning Medical Update. In just a few hours, the CDC Advisory Committee on Immunization Practices meets, and we are going to hear from member and OBGYN Dr. Kevin Ault on what he expects to hear and learn, as we know too many expectant and postpartum mothers are getting seriously ill with COVID-19, putting both themselves and their baby at risk. But first, we want to check in with Dr. Dana Hawkinson this morning. Good morning to you. How'd we do since we saw you last yesterday?
Yeah, thanks for that, Jessica. You know, we don't have the numbers today, so I'll let you know that. But we will get them for everybody. Just a little bit of delay in the computer reporting, but we'll get them. But Hays does have 13 active and 3 in that recovery period. So they've gone up too. They were down a little bit, I think to 10 at one point, but have since increased now to 16 again. So still, again, 16 patients overall in their hospital is a significant proportion of their inpatient capacity.
You know, I have to check in with you because if people don't see your face, people will go all askew.
And I will let you know when we get the numbers.
Okay, we will check back in with you. But let's see if there's any reporter questions for you on the line today. No reporter questions. Okay, so we're going to get to your community questions here in just a moment. I've already gotten a few coming in this morning because we've got Dr. Ault, Dr. Kevin Ault. He is OBGYN here at the health system and also a member of the Federal Advisory Panel for COVID-19, otherwise known as the ACIP committee. So thank you for joining us. We always have questions where we tell people you're coming on, Dr. Ault. We start getting those questions trickling in, and we're going to get lots of them today. So I want to start out with something, though, about Pfizer expected to ask for emergency use authorization for children 5 to 11 years old in just a matter of days. This is something we've been talking about, but what's new about that announcement this morning?
They've made several announcements along this lines, and what the process is that they give their data to the FDA. The FDA will have a similar meeting to the ACIP meeting called VRPAC, and they all give it a thumbs up or a thumbs down for the emergency use authorization, and then we will meet about clinical consideration within a matter of days. This may take a few weeks for the FDA to act because this dosing is different than the adult dosing, and so people from the FDA actually go to the factory and look at how the vaccine is made, look at different lots of the dosing. So there's a lot that goes on behind the scenes that the public doesn't see that the FDA does before they have their public meeting.
Right. So this is not just a quick phone call, let's get this approved. You actually are doing a lot of work and research in this. This is why we have to keep talking about this. Right. So I think there was some hope that this might go through by the time Halloween hits, which wouldn't really matter. There's no real way, I would imagine, for somebody to get full vaccination and immunization in that short amount of a time, but we're getting close.
Right. I would guess, and my guesses have been wrong frequently before, but my guess is this will all be settled before Thanksgiving, yes.
Okay, that's good, before the holidays. And parents should look at emergency youth authorization as good news, thumbs up, go get it, just the way you did when it was for us as adults, correct?
Right, so there will be a study, and these studies have been making it into the New England Journal of Medicine, no surprises there, with tens of thousands of children enrolled, and we'll know something about the safety and efficacy of the vaccine when that gets published, and it'll be discussed at our meeting and the VRPAC meeting. Of course, then we start giving it to millions of school children, and we'll do safety monitoring with a much larger subset later. So,
Dr. Hawkinson, jump in on that.
Yeah, so we did get numbers today. So we have 33 inpatients that are with active infection. Again, I think that's up just a little bit. Certainly if we can hold it down into those low 30s, high 20s, and even lower, obviously, you know, that's a good thing from where we are a few weeks ago. So of those 33 active infections, 12 are in the ICU and 7 on the ventilator. We still have 38 meeting that recovery category, so 71 total.
All right, thanks for that. We'll jump back in with you here in just a moment. Dr. Ault, the CDC meeting, the ACIP committee is meeting this morning, correct? What do you?
Actually, we're going to meet tomorrow.
Okay, what do you expect?
We're not doing any COVID tomorrow. We're going to try to catch up on a bunch of other recommendations that have kind of fallen by the wayside. One that I'm particularly interested in is hepatitis vaccination in adults. Probably a lot of people know that hepatitis has been going down tremendously in the United States because of newborn vaccination, but for people between 30 and 60, it's been going up. So we're going to talk about that. We're going to talk about some tropical medicine vaccines and traveler vaccines. There's actually been a lot of non-COVID vaccine stuff going on. It's too bad that doesn't make it into the news as much, like a dengue vaccine. And so, that's what we usually do when we meet 3 times a year. I think when we were talking before, we've met 15 or 16 times this year, almost always about COVID. But tomorrow we're going to talk about other things.
Dr. Ault, you can always talk about other things here. We do like to learn and hear about other things other than COVID, right, Dr. Hawkinson?
There isn't the microscope that COVID has put on really all aspects of a drug, vaccine, and treatment and prevention mechanisms that we have seen since other things have been around, just like Dr. Ault said.
Right. There's life. What life was before COVID, and life will be after COVID. So we want to hear and learn more about that as well. So always share what you're learning in those meetings, please. But as an OBGYN, walk us through the past 3 weeks. What it has looked like for unvaccinated pregnant people. Are they struggling with the Delta variant? I know that you did meet last week to talk about pregnancy safety data. So what were you learning there?
Yes, we talked quite a bit about pregnancy safety data. We have a couple of different systems in play that we're getting data from. One is the vSafe app that everybody has on their phone who's been vaccinated. And if you've done that, thank you, because it's producing some really nice data. There are 35,000 pregnant women who've enrolled in vSafe, and we're getting data from them. The first batch of data looks like there's no increased risk of birth defects or preterm labor or miscarriage. There's a similar system called the Vaccine Safety and Data Link System, VSD is the short for that, and they just had a major publication earlier this month in the Journal of the American Medical Association, again looking at miscarriage rates. They're not elevated if you get the vaccine. Those are the easiest things to study because it's a relatively short-term thing. If you're going to study for birth defects or preterm labor or 2-year follow-up of children, that's going to take a little while. But these first reports look really good. And at the same time that's going on, we had the president of ACOG, Dr. Tucker, come and talk to our department recently, just a week or 2 ago. He happens to live and work in Mississippi. Mississippi Health Department, the Friday before he spoke, had a press conference where they talked about increasing risk of stillbirth due to COVID. So there's more and more data that links it to bad birth outcomes such as stillbirth, preeclampsia, also called toxemia, preterm delivery. And so the news is getting worse as far as the pathology of the disease in pregnancy, but the news is getting better about the vaccine in pregnancy. So that's all happened really over the past few weeks.
We're going to get to your answers to your booster questions here in just a moment, because I know many of you have them. I do just want to stay on expectant mothers and pregnancy and the importance of people who are expecting to get vaccinated. You talk about it every time you're on the show. We're in a place now where we're seeing still people on the fence and hesitant. What are your thoughts about that? What can you do to help people work through that decision? What can you say?
Well, I think when I talk to patients about the flu vaccine, it's somewhat of a similar talk. There are benefits to you personally. The vaccine is effective in pregnant women at preventing you from getting the infection. There are benefits to your pregnancy, as far as decreasing your risk of preeclampsia and stillbirth and those type of things. And there are also benefits to your newborn. The antibodies that you make, the maternal antibodies, cross the placenta, the afterbirth, and are present in the baby for a few months afterwards. And so usually those 3 points, emphasizing those 3 points, is a reasonable conversation to have with your obstetrician, and frequently makes sense to pregnant women. They want to do things to protect their pregnancy and their newborn, and that usually is what makes pregnant women want to get vaccinated with any of our vaccines that we give during pregnancy.
All right, let's get to some community questions today, and I want to stay on this topic because we got a few coming in. So one viewer felt good in the beginning about what she was hearing about her daughter getting the vaccine and felt encouraged about it. But now the study's coming out about the menstrual cycle. So we need to talk a little bit about that. She's now back, she says, to square one with her concerns after some of these studies about menstrual cycles are coming out. Can you walk us through that? What do we need to know?
So I don't know if there's been a study, but there's been reports about interruptions in menstrual cycle and abnormalities in menstrual cycles. And so it's been a topic of study. That's something you can actually kind of research you can do just by surveys. The University of Illinois has a survey going on. There's a similar survey at the Imperial College of Medicine in London. And so there's beginning to be some studies like that. The NIH has also launched a similar study. It's a very difficult thing to study. If we're gonna talk about third doses, we're talking about giving those to 50-year-old women. 50-year-old women are going to have irregular periods whether they get vaccinated or not. When we were doing the human papillomavirus vaccine research 20 years ago, we did find irregular periods, but we were studying teenagers, and the rate of irregular periods were the same in the people who were getting vaccinated and the people who were getting placebo. So it's going to be a challenging thing to study. It is biologically plausible, however. There are immune cells in the endometrium, the lining of the uterus, and it definitely participates in the immune system. It's highly unlikely to have long-term effects, but it would be nice to be able to counsel patients about short-term effects of vaccination. And so that's where I think this research is going and what we will find out eventually. But yes, there seem to be reports of irregular cycles temporarily related to vaccine over the short term.
And Dr. Ault, you must know that there's nothing more sensitive than a woman who's trying to have a baby, or a couple trying to plan their family, and certainly a parent trying to make good decisions for their young daughters, for their future. So it's a question I get, and here's one I can relate to as well, because going back to menstrual cycles and doing IVF, I'm an IVF mom myself, so for this viewer, I totally understand your concern here, and she brings up a good point. But is there any correlation with the vaccine and messing up a woman's menstrual cycle? Because she says she can't start her implant process until she's had her cycle and it's normal, and wants to know if there's been any statistics of women who have gone through the IVF cycle and had a good outcome. Do we know anything about that?
Again, that's an easier thing to study, because you can look at women who are vaccinated and unvaccinated and the outcome of their IVF, because that's certainly been going on during the pandemic, and there's no difference. So there's no difference in IVF outcome. Most infertility doctors in the United States belong to the American Society of Reproductive Medicine, and they've been a big proponent of getting this vaccine and stamping out the misinformation we've heard about infertility. So if you're going through IVF, you should get vaccinated. This brings up another good point about irregular cycles. I don't do in vitro fertilization, but we give lots of hormones to women who are having this. So we give lots of hormones to women who are having IVF, and we certainly mess up their cycles by giving people hormones. That's another good example of this gets to be tangled pretty quickly.
Well, and you're also able to control the cycle as well. Yes. through those hormones. But it's a fair question, because I think some people are thinking, should I hold off on going through my IVF cycle? You're putting a lot of money, a lot of eggs in one basket, so to speak. So do I hold off and wait till there's more research? Or you're saying if a mom was sitting here, you would say, nope, it's okay to get vaccinated, and it's okay to go through with your IVF cycle.
Right. There's already a pretty good amount of research, again, because this is a little quicker thing to study. And the American Society for Reproductive Medicine has a wonderful information on their website. I certainly refer you to that. There's similar information on the American College of Obstetricians and Gynecologists website, ACOG. There's a frequently asked questions section that I would refer you to.
Okay, I promise, last period question. Okay, Angela wants to know, have doctors heard about pregnant women spotting after getting vaccinated?
So being an obstetrician for a number of years, this comes up pretty frequently. I tell my patients, between a quarter and a third of women who have normal 8-pound babies 9 months later are going to spot an early pregnancy. So again, that would be a very hard thing to study, because it's very common anyway, plus it can be part of a normal pregnancy. So I'm not sure you're going to find a correlation there. Is going to be the short answer to that question.
So I think the common theme through all these questions are complications and stuff. What continues to be your overriding message to all of these questions about vaccination and pregnancy? And
pregnant women are at increased risk of lots of bad outcomes, and they should be vaccinated. I mean, that's the short version of multiple days of meetings. So,
okay. So, Allie has a question. on that same line, what about vaccinated pregnant moms with COVID? How are they doing? If they've been vaccinated, have COVID?
So we have data about the efficacy of the vaccine. There's an Israeli study and I think an American study both, and it looks good. But off the top of my head, I'm not sure I remember if they controlled for that. Of course, there's data in non-pregnant people that the vaccine does well after you've had COVID. So I'm not sure that would change our advice. But we could certainly dig through those publications by the next time I'm on the show and talk about that. So.
Okay, we will get into that. Let's get to some booster questions. Kitty wants to know, do we know, are boosters being distributed county by county in Kansas? Do you know how they're being distributed by chance? If you don't, we can find that out. But
I don't know the answer to that. So that was Friday that we decided that, and so it's Tuesday, so that's a pretty quick turnaround. So I don't know the answer to that off the top of my head.
Yeah, and I don't know. I mean, with the glut of supply that we have around the nation, I'm not sure that there's any real change in supply at this point in time. But
no supply issue.
We'll certainly try to get that answer.
Okay, so Joanne wants to know, do we know if the kids will be needing 2 shots like adults?
That is a great question. 2 shots, and we had our meeting last week. We actually went 90 minutes over talking about this particular topic. So, 2 doses of the mRNA vaccines provides excellent protection against hospitalization, serious disease in adults. There are some vaccines where children and adolescents need less doses because they have a better immune system. And they're also less at risk for disease. So if you wanted to speculate, children might not need a 3rd dose. But again, that's in the absence of data, and that'll be, decided maybe in 2022. So that's a longer term question.
I like this question from Samantha because I didn't think about it this way. She says, my 10-year-old weighs over 100 pounds. Would any providers consider giving them a full dose since that weight is that of maybe a petite adult female?
So I think the age probably matters more than the weight in this particular set of circumstances because of what I just said about the young immune system. But we've had plenty of people from children on the Children's Hospital on the Children's Memorial Hospital on the Children's Mercy Hospital on the show. So save that for them.
I will save that.
So, but first impression of that question is probably given them the age appropriate dose.
It's the age based on the immune system.
Right. I don't think there are any other vaccines that we change the dose based on weight.
Okay.
So.
That makes sense, though. Okay. Samantha, I get it. I think that was a pretty good
That
question.
is a good question.
It is. So I will ask Children's Mercy when they're on next week.
Right,
okay.
Since
So
I stumbled over there. You could tell I was stumped a little bit since
Dr.
I stumbled
Ault,
over the name
you don't have to know
of
everything, I
Children's
promise.
Hospital,
You know a ton, so you don't have to know every single thing. So thank you, though, for taking a stab at that. So Ashley wants to know, I'm a vaccinated pregnant woman. She's 36 weeks today. Should I get a booster? I'm 6 weeks out on Monday. Her last shot was April 5th. Do the math. And should pregnant women be getting their boosters this close out?
So we're recommending 3rd dose boosters for people who are more than 6 months out. And so I don't think you're quite there until a few more weeks. The main advantage of you getting a booster 6 months out would be the postpartum period, because there are some data that those respiratory diseases that cause problem in pregnant women do persist for a few months postpartum as the heart and lungs are going back to normal. So it's certainly something you could consider. We don't have a lot of data about pregnancy and 3rd doses yet. I mean, again, that'll be coming because people that got enrolled in VSafe are healthcare workers, and a lot of them are going to be getting 3rd doses. So I mean, there are some advantages, but there are advantages also to waiting 6 months. Tony Fauci was on the national news yesterday when I was listening, talking about this very same thing. So yes, if you wait 6 months, there might be some advantage in the peripartum period for that.
And Dr. Hawkinson, I know you've mentioned this too, but waiting that 6 months is key, even if you consider yourself a high-risk person, like a pregnant person, correct? It's really about waiting that window out. Is that correct?
Yeah. I mean, I would say so. And we have good data that even further than 6 months, you are still very well protected. Again, being an otherwise healthy young woman, after you've given birth, a lot of things should return to normal. We know that the pregnancy state is immunosuppressive or can lead to complications, as Dr. Ault talked about. So I think waiting that further period, if you don't have any other underlying conditions, is certainly reasonable.
And I was just doing some math on Ashley because she says she's 36 weeks today, got her shot back in April, so she must have gotten it pretty early on in her pregnancy. Any thoughts on when to get it? As soon as you find out you're pregnant, get it? I mean, get it. I know that. But I mean, if you're past a certain amount of time, should you hold out until after you've given birth? Or
that was one of the reasons we looked at miscarriage first, because it's certainly safe to give during the first trimester. We have a lot of people got vaccinated in the second and third trimester, so the middle third and the last third of pregnancy, that we have data on about birth defects and preterm birth and that type of thing, and there's no risk. So really you should get it any time. Pregnancy is frequently an opportunity to get caught up on a lot of things that that young people may have not been involved with. And so we frequently kind of do an overview of health at that first prenatal visit. And so that should come up when you go see your obstetrician or midwife the first
Dr.
time.
Ault, I'm going to ask you these questions 100 different types of ways. I've got to do it because I know what these women are doing. They're doing what I did, 2 and 3 o'clock in the morning. You're scrolling online and coming up with everything you can possibly
But I would
ask.
like to say is, just as the CDC recommends, never miss an opportunity to vaccinate.
Well said. Well said. Okay, so Kitty says, I read an article about the COVID pill that is at a clinical trial. If you are in the early stages of COVID, you are administered a series of tablets. What are your thoughts on this trial? Do we know anything about that?
So I do not know much about the trial other than what sounds like it's been in the news. There's been hope for antivirals for coronaviruses because of the other 2 epidemics we had earlier this century. So antivirals are very tricky to develop. And so, and you'd expect this kind of research to take 3 to 5 years. So I don't think, we're going to have something by the end of this calendar year. But again, predicting the future is very difficult in this environment. So maybe I should defer to Dr. Hawkinson about some of this.
Yeah, absolutely we'd want it. I think what we have seen with a lot of viral illnesses, though, is that sometimes you need more than one drug. Certainly if you look at HIV, there's a cocktail of drugs. So I think it's good news. Obviously for influenza, we have Tamiflu. We'd certainly like something like that. But I think for people to stay up to date on all of these trials, because there are so many, I think one of the best sites that I've gone to is the Regulatory Affairs Professional Society, or raps.org. And in their search menu, you can search for either therapeutics tracker or vaccine tracker, and when you do search for those things will come up, and all of the vaccines that are being looked at and studied are there, all of the therapeutics that are being looked at and studied are there, and their current status as well. So we know that there are a lot of things that are being currently looked at. Certainly we would hope that there would be some sort of oral, early initiated viral therapeutic that would come out, but again, it takes time for these things to be evaluated.
Clinicaltrials.gov would have very similar information on it. There's usually a paragraph at the beginning of the protocol that tells you in lay language what they're trying to study and gives you time frames. So if you know the name of the drug and the company, you can almost always find it on one of those websites.
Deb wants to know, how long should someone over 65 and in general good health wait to get the 3rd shot?
Do you want to answer that? Or you want me to?
I'm always going to try to push that out as long as possible. However, that being said, if you are over 65, that is the best data that we have, those people in that older age group. So, I think depending on what you're doing and what your exposure is, if you need to do it at that 6 months after that second dose, then do it then, because that really is where we have the best data for those that demographic and that subpopulation that needs that extra dosing.
And that's what we talked about quite a bit last week when we had our meeting, as over 65, people living in nursing homes, other long-term care facilities. There is some data, there's waning immunity and more symptomatic infections in that group. And so that's the group that most clearly benefits from a 3rd dose. Although we did also talk about a study, and there are similar studies with flu, about making sure the staff and the visitors get vaccinated. So we can protect that segment of the society by making sure that people are vaccinated around them. And that came up and was emphasized as well.
Amber wants to know, would you recommend a healthcare worker with no underlying health conditions who received their second Pfizer vaccine in January to go ahead and get the booster now?
So that fell under the may get a booster category in the under 50. Occupational exposure was one of the groups we looked at between 18 and 49. That was probably one of the things we talked the most about. Of course, there are 20 million healthcare workers in the United States, and so it's going to be hard to give a specific recommendation to every one of those people. If you are working in a COVID ward and get exposed every day, certainly it sounds like a good idea. But if you're doing telehealth and you're at home in your home office or in your office at work, maybe not so much. And so I wanted to speak first because I know Dr. Hawkinson probably has some opinions too.
So. No, I agree with you, and it's hard because of the vagueness of the word may be considered for it. So I think it boils down to your individual risk tolerance. Obviously, we believe it's going to be safe and that any harm is going to be minimal to none at all. And what is the benefit? Hopefully, it can be extremely high benefit, and also, again, offer with these new third doses maybe a little bit improved ability to transmit the virus even after vaccination, because we have seen, although after vaccination you transmit the virus significantly less than if you're unvaccinated, maybe giving this initial or this additional dosing, maybe that initial boost of antibodies now after this additional dosing will also help reduce your ability to transmit. So I think it's a very good question. I don't think we have a single black and white answer for that, though.
The thing that I brought up at the meeting and several other people brought up is, probably depends on your work environment too. If you are short-staffed and to have somebody out because they were exposed or because they have a mild illness, of course, people that are fully vaccinated with 2 doses of the RNA vaccines are not going to get sick, but they're going to miss work with a mildly symptomatic infection. If that's important in your workplace, that might figure into it as well.
So answer me this then. So my 74-year-old mother went in to CVS, got her flu shot, and got her booster. Then my 50-year-old sister, who's a teacher, went in to get her flu shot. They offered her the booster. I know if you come here, you have to it has to be passed on through your physician has to authorize that. So can just anyone walk into a CVS and say, I want the booster, if you're in your 30s or 40s and just want it? Or how, and is that okay to do?
So back in 2020, we set up a system. This was something that the CDC did, and in retrospect was a great idea, to distribute this vaccine in pharmacies. And CVS and a lot of other pharmaceutical chains nationwide, before we ever had a vaccine, agreed to be part of this system. So, and they will follow the guidelines that we voted on and were published on Friday and Monday. So certainly, I don't know anything about your 50-year-old sister's health, but they will ask you questions and see if you're following the guidelines. I think that's...
And she's healthy, but I think it's when she said that she worked at a school.
Right, so she falls under the may category for exposure.
And, in some cases, I almost think that being in that school puts you at higher risk compared to being in a hospital or healthcare system where we know people are wearing masks and eye protection and doing those things and have had that training. Where in the schools, there is always sometimes that dichotomy there, some of those suboptimal practices. So if we can keep teachers in schools, all the adults in schools, keep the kids in schools, that is a huge goal. And so certainly she would fall under that risk category.
Yeah, that makes sense. So you're saying, though, that if folks walk into CVS, they should be following the guidelines and asking the right questions and not just letting anybody get it.
Again, we talked about that quite a bit last week, but because the way the system has been set up, they're following our guidelines, which is why these meetings are so important and public as well. We have 40,000 people listening online to what we say in these meetings. So,
Joellen has a question, and it's kind of like what my mom did when she went in to get her booster and her flu shot. She said, what should I get first? She's 73 and just had hip joint replacement. Sounds like none of that matters. You can get them both at the same time. Is that right?
You can get them both at the same time. We didn't want to put a barrier for these make 2 visits out of 1. And so certainly get them both at the same time. The flu vaccine recommendation is to get it before Halloween. So we've got about a month here to try to get as many people vaccinated. There are some data that look very dismal about people that are co-infected with influenza and COVID, and it looks really bad, the data that's been published. It's an evolving story, so we don't want to see what we call a twindemic of the two this fall. So certainly get your flu shot, and that's everybody 6 months and older in the United States, and get your COVID shot as appropriate. We didn't have much of a flu season last year because of masking and social distancing, so I'm really worried about that. And I would like to be wrong in the long run, but I'm concerned about both of them circulating at the same time.
You're rarely wrong, though, right?
Well,
it happens from time to time. Is that what you're saying?
It's an easy situation to be wrong in, but we, Dr. Fauci during the flu season, frequently was on TV pre-COVID and would say one thing about the flu is it's always unpredictable, and so this is your chance to take some of the unpredictability out of it over the next few weeks.
As Dr. Hawkinson says, never miss a chance to get vaccinated, but neither getting one before the other isn't going to affect either, I think.
No, I mean, you'll have two sore arms instead of one sore arm.
We can handle
what it boils down to, so yeah.
We can handle that. Okay, Nancy's joining us, and you may have already answered this, but how do we know that these menstrual cycle changes are temporary? The vaccine hasn't been out long enough to know what the long-term effect is. What are your thoughts on that?
Well, we're going to have to do studies. So, I mean, we're a data-driven profession, and the ACIP is a data-driven group. So we're going to have to do studies about that. However, there's, the vaccine is made out of RNA and lipid, and, we have enzymes that break down RNA. So I'm going to bring a first-year medical student with me someday so they can go over these pathways with you. Your body breaks down RNA, your body breaks down lipids. These vaccines last a few hours in your system. So, and the spike protein that's made that you have the immune response to is recognized as a foreign protein, and that's why you have a sore arm after you get vaccinated. So I think vaccines generally do not have long-term effects because they're just given for 1 or 2 or 3 doses. So, and this vaccine especially doesn't really have a biologically plausible mechanism for long-term effects.
Okay, Kimberly may have the last question. If you have any last questions, send them in. But Kim wants to know, what are the underlying comorbidities of the patients in the ICU and on ventilators? Are those comorbidities changing because of Delta here at our hospital, or even just across the country? Do we know just what that's looking like of those folks in the ICU?
Do you want to go first, or want me to go first?
I can go first as far as here. We know that our vaccinated population does have significant comorbidities for those patients in the ICU. Don't have a lot of data. We can certainly try and collect some of that from our current people who are in the ICU. But again, we do get a lot of patients. We get a lot of draw of patients who have those underlying comorbidities and those immunosuppressive states at all. But we'll see what we can do if you were asking specifically about our hospital.
Yeah, at a university hospital, you're going to get a much different population than the general population. So I was going to refer people to the CDC website. They have about 18 or 19 risk factors, of which pregnancy is one of them, but some of the others are pretty predictable, and that might give you guidance about whether you need a third dose of the vaccine as well. And so I just looked at that the other day, and it gets updated frequently, and so you can find out if you're on that list and somebody who should be considering more strongly a third dose.
All right, I've got 2 booster questions left for you.
Okay.
Morgan wants to know, what warrants a possible annual booster versus a single series vaccination, like a childhood vaccination?
So that's another predicting the future question. So it's going to be very difficult. Prediction is very difficult, especially about the future, is what I've been saying.
Bring your crystal ball next time, right?
Yeah, I think it depends on whether this becomes endemic, whether it's something that never really gets out of circulation. So then it would be something similar to influenza. So, or if the Delta variant stays around and we can beat it down, to a reasonable amount. We need the best estimate we need for herd immunity is about 85% coverage rate. And when I was getting ready this morning, one of the local news stations says we're about 50% both in Missouri and Kansas. So we have a long way to go for people that have had 0 doses, rather than talk about boosters. We really need more people to get their first and second dose rather than their third dose.
Well, I'll ask you because we get that question. Do you ever think it's going to go away?
Again, predicting the future, my best guess would be no, but I wouldn't mind being wrong. So
That's one we wouldn't mind you being wrong on, right? Okay, so I do have a question from Carla. Since you need to wait 6 months after the second vaccine for the booster, do you think people that are due for their booster now should just hold off on a booster until they adjust it for variants? Are they going to be adjusting it for variants?
So the short answer to that, I think, is yes, there are some clinical trials going on with the variants for all the companies, but the vaccines actually look pretty good against the variants, the ones we have now. So whether there's a clinical need for that is debatable, I think. And so if you've had the 2 doses, you're well protected against severe disease and hospitalization. And so that's why we try to give some guidance around a 3rd dose 6 months later. Yeah. I wish I would have written down what Dr. Fauci said, because he talked so eloquently about the immune system and the lymphocytes, but basically you give those elements of your immune system a chance to mature if you wait those six months. So.
Yeah, no, I mean, I think that's exactly right. Initially, when we started seeing some of these variants pop up, particularly, the Beta, the 351 out of South Africa, obviously Alpha, the P1 out of Brazil, we were concerned that are we going to need more vaccines now because of the variants? But just as you said, Kevin, our vaccines that we have now are extremely efficient at protecting against the variants. And this includes, especially if you've had prior disease with COVID-19, it is so vitally important to get vaccinated, because what that does is that boosts those specific immune responses, but it also helps those immune responses to evolve and mutate, if you will, to create those other specific or cross-reacting antibodies and T-cell responses after that vaccine. Those vaccines boost that immune system reaction that you get after even having normal or regular COVID-19 infection. And so these vaccines, even if you don't have prior infection, also continue to cause that continued evolution of your immune system. And so what they are finding is that those people that did get vaccination, whether after infection or without any infection, had that increased breadth of reactivity and evolution of their immune system to take on and deal with variants that we know about and even variants we don't know about yet. So that continues to be studied, and obviously, as Dr. Ault said, as more variants come out and we are able to identify those, we will then see if any vaccine is needed to pivot. However, right now the vaccines we have continue to offer extremely good protection against all the variants that we've seen.
Did you have something to add, Dr. Ault?
Dr. Collins is the director of the National Institutes of Health and does a wonderful blog, and actually talked about that exact thing in June in language that we can all understand. So if you really want to get a deep dive, look up Dr. Collins' blog from a few months ago.
Fantastic. Okay.
And that was on the computer, though, not TikTok, was it?
It was. It's on the NIH website. He has a nice Twitter account too. If you follow him
actual
on social media,
reliable social media,
and somebody can explain things very well, like Dr. Fauci and Dr.
to people
Collins.
like me who do not understand. Okay, I'm going to end with Pam's question and have you do a little myth busting to help her out so she can explain to somebody. Because I think that is it. A lot of our viewers want to know the answer so that they can then share the information with people who disagree with some of the things we're saying. Okay. So Pam says she would really like it if we could do an episode where we list the ingredients in each of the approved vaccines so that we know what the ingredients are, what they do, and info on how they interact with our immune system and our body. She says she has a friend who swears the vaccine changes your DNA, and I'd like to have correct information to share with her.
So I kind of alluded to this before. That's the first year medical students learn this, and then some of us forget it later on. But messenger RNA is what gets made from the vaccine that encodes a protein, and so that's a one-way path in your body. DNA makes RNA makes protein. It doesn't go backwards in human beings. It does in some viruses, but not in the human genome. We don't have that equipment on board to do that. So that's a myth, unfortunately. I talked about the ingredients a little bit when I talked about lipids and RNA. I mean, it's really pretty simple. There's not an adjuvant in these vaccines, the RNA vaccines. The Johnson & Johnson vaccine's a little different because it uses a viral vector. Yeah, I mean, we could certainly talk about that. They're going to have big, scary, long scientific names, but basically it's lipids and RNA that your body handles every day, every cell in your body.
Yeah, there's very few components, I think 9 or 10, depending on what vaccine you're looking at. Again, we're talking about just the mRNA vaccines right now, but they're freely available. They were freely available in the FDA briefs that they were submitted to the FDA, so that's probably the best place to get them. But otherwise, besides the lipid nanoparticles and the RNA, which is going to be broken down quite quickly, as Kevin had said, inside your body. The rest of the materials are really fairly inert, and it's materials that you otherwise take in. We had talked about this before with the PEG, one of those things that we use for colon preps and other things as well. So these are really otherwise fairly common components and ingredients overall in these vaccines, and there's very few of them if you look at the recipe.
I was in a meeting a few weeks ago where people were talking about unexpected sources of good information. A lot of this is on the New York Times webpage about these real fine specifics. So that might be a good place to start for good quality information.
So that was a good Biology 101.
Yes.
We may need Biology 102. I know I do. So it's a fair question because I think that's it.
Yeah.
You're right. We see I
is.
can't look on the back of almost any ingredient, anything I have, and I can't pronounce the names. I don't know what they are, what they're doing in my body, yet I put them in there. So yeah, I think it's fair to know. And certainly,
I think a lot, again, very few components, probably much less than things that you ingest every day in your daily routine.
Probably true. And then just knowing how, like you say, a lipid, most people don't know what that does once it gets in your body or how safe that is. So, okay, so thank you for that lesson. And we're going to get to some final thoughts. Thank you all for your great questions today. People always have them for you when you come here. So you'll have them many, many more when you come back. Final thoughts. What do you want us to know, Dr. Ault?
I mean, I think the downside of our meeting last week is that, when we talk about third doses of vaccines, we really need people to get dose 1 and dose 2 more is really how we're going to get to the end of this pandemic. So, so we're really talking about a pretty small subset of people that are going to benefit from a third dose of vaccine. So my final thought would be, let's get everybody vaccinated that's eligible for the vaccine.
Dr. Hawkinson.
No, I completely agree. I think boosting or additional dosing, especially for those people that fall into those high-risk categories, is extremely important. But we also need to continue focusing on first dosing. And I think I saw some stuff out of the New York Times today, just as Kevin had talked about, dosing for minorities, particularly African American or Black populations, as well as Hispanic, is increasing as well. So I think getting all of our population with those first and second doses of vaccines is vitally important.
All right. Great message. Thanks to both of our doctors today. And thank you for being with us. And yes, tomorrow, Dr. Stites, he is back with us. It's Open Mics with Dr. Stites. He is going to be joined by some special guests. They are pitching in where they are needed most. How doctors here in KC are helping doctors in central Kansas care for critically ill patients without an ICU. That is tomorrow. But before we go, I want you to watch this video and carry this message with you today. As Dr. Stites has said repeatedly on this program, freedom comes with responsibility. We have choices in this life, we all know that, but they come with a responsibility to those around you. So I want you to have a great day. We're going to see you tomorrow here at 8.
Virus doesn't care what border you have. It doesn't care if you're a red state, blue state, Missouri, Kansas. It's going to spread, and I think that the most effective therapy that is clear is vaccination. We have to keep each other safe. For example, if you're going to go into a restaurant, the people in the restaurant can't say, well, I'm going to cook the chicken at 100 degrees instead of 160 degrees because that's my choice, right? You can't say that because that's going to produce an unhealthy food because it's going to make you sick. So at some point, we all have to remember that we have the freedom of choice, but we have freedom with responsibility. Exactly. You can't decide I'm going to drive my car into somebody because I want to. You can't run a red light because I don't want. I have a choice. I don't want to run this red. I don't want to watch this red light. Screw it and go into the red light and hit somebody. rules in society, and those rules are meant to do the public good and promote the general welfare and provide for the common defense and to promote the blessings of liberty. You really aren't free when people can do anything they damn well please. That's actually not freedom, right? That's anarchy. And I think what we have to recognize is there's a difference, and that when we work to keep each other safe, when we do that right thing, then I think that is what a real democracy is like. If you step back and you can say, well, people do have the right to their own body to make a choice about vaccination, and in this country that's true. In this health system, we've said we have a vaccine requirement. And I think we stand behind that because we know we're taking care of people every day, and we know that vaccination helps keep our staff safe, it helps keep our patients safe.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now everywhere podcasts are available.